My name is Shahin. I'm consultant psychiatrist, professor of psychiatry, and editor of Global Psychiatry Archives. And I'd like to report a paper from Islam Shahim and Allan Young about measuring mixed depression. And it's an editorial. It's quite short. And these changes have been recently in DSM-5, and the DSM-5 came up there with the fact that a mixed depressive episode, that's what we're talking about here, has symptoms of depression, but also elevated expansive mood, inflated self-esteem, more talkative idea, flight of ideas. So these are symptoms which are more or less into the bipolar range. If you take this bipolar range, then you have a low frequency of mixed mood states. However, if you take the ones which possibly are a bit more interesting, which focus on psychomotor agitation, distractibility, irritability, racing thoughts, increased talkativeness, and emotional lability and inattentions, insomnia, and risky behavior. These are the ones which Koukopoulos recommended. If you use these criteria, it's much more frequent. So it seems that these criteria, which have been put into a scale by Dr. Shahim, are more interesting and more relevant than the ones which are a mixture of bipolar and depressive symptoms. So I think there seem to be specific symptoms of mixed depression, and most clinicians would recognize them easily. But the mixture of bipolar disorder and unipolar depression symptoms, in my view, and possibly this editor's view, of this editorial's view, it seems to be less likely. So it's quite an interesting part of the discussion. If you want to read more of that, please go to the journal Global Psychiatry Archives, now called, and it's on www.globalpsychiatry.co.uk. And if you want to hear more of these snippets of information about papers, please subscribe to our channel. Thanks for your interest, and have a nice day.